Hello, my name is Raphael Gould and I'm a fifth year medical student at the University of Edinburgh. Welcome to this quick oral presentation on reasons for refusal in mild cognitive impairment. I'd like to start with a question. What is a major barrier negatively impacting Alzheimer's disease clinical research today? Take a second to have a think. Evidence suggests that participant recruitment is the primary barrier negatively impacting Alzheimer's disease clinical research progress. I recommend this review article by Fargo et al. Indeed, the struggle to enroll participants is a long-standing issue in dementia research, dating back from the 90s. Why is this such an issue? Participation issues can delay research, even leading to unpublished data, if they fail to reach the power requirements of the research. And secondly, major recruitment challenges in dementia research leads to concerns about the representativeness of study samples. As an example, African Americans remain underrepresented in Alzheimer's disease research, despite experiencing higher incidence and prevalence of the disease compared with their Caucasian counterparts. Issues with recruitment will not go away in the future. With the prevalence of dementia increasing in an aging population, the burden of disease will increase, and the need for effective treatment will become more apparent. Secondly, many clinical trials in the future will focus on the pre-dementia state, which represent unique challenges for recruitment. Typically, people in these early phases of the disease are unaware of their higher risk of neurodegeneration and are not treatment seeking. Thirdly, the FDA approval of aducanumab, manufactured by Biogen. This is the first drug to be approved for Alzheimer's disease in several decades, and many patients and their families will choose to be treated with the approved drug. But it is critical to bear in mind that there are many other drugs currently being developed, and effective recruitment into these ongoing clinical trials is needed more than ever. Also of note is the effect of COVID-19 on Alzheimer's disease research recruitment, but this is beyond the scope of this talk. Summarized here are the results from our initial literature review, looking at the reasons for participation in and refusing Alzheimer's disease research, in green and red respectively. Take a minute to pause this slide to have a look at the reasons. There are many criticisms of existing literature. Namely, studies do not focus on reasons for refusal in the pre-dementia state, despite its pertinence in dementia research. Reasons for participation are well documented, but selection bias occurs. Responses are taken from those already participating in dementia research, meaning the sample is not representative of the general population. Studies looking at reasons for refusal, on the other hand, use hypothetical scenarios. This leads to question of intention via actual behavior. And studies focus on proxy participants rather than the primary participant who is making the decision. Finally, studies are often retrospective and not conducted at the point of the decision. So the aim of our research was to understand the reasons for refusal of potential participants in an ongoing study in mild cognitive impairment. Individuals were approached in 5 different memory clinics in Southeast Scotland to take part in an observational study, looking at the impact of risk disclosure in mild cognitive impairment. We then documented the reasons given why eligible individuals refused to take part in research. We will put these findings into the broader context of literature by conducting a systematic review. And here are the results. As you can see on the left, there were 180 eligible participants, 36 pre-screen failures, and 16 unable to be contacted. Of the 128 approached participants, 65 refused research, and the reasons are given in the pie chart on the right. We can see that the most frequently cited reason for refusal was that taking part in research was not the sort of thing they would want to do. And secondly, the lack of interest in the study. Other reasons for refusal included feeling the research was too much, not considering themselves to have memory problems, not suitable for their life right now, and too much anxiety around memory. Other reasons include not accepting anything over the phone, the length of time for each visit, and refusal of outside contact. Understanding the reasons for refusal given by potential study participants allows us to better understand the decision-making process of participation in dementia research, as well as the barriers to inclusion. These barriers should be considered when engaging the mild cognitive impairment population and could help inform recruitment techniques in the future, making research more accessible and study samples more representative of the general population. Moreover, barriers to inclusion of potential participants in dementia research can help us understand the needs and priorities of people with dementia, which will help improve the relevance and quality of health research. Thank you for listening.